The number of hospitalizations in New York State has slowed, a pattern that has been consistent for more than a week now. But to give you some perspective, more than 15,000 people in the state have died from COVID-related complications. In New York City alone, 35,000 people are estimated now to be hospitalized with COVID-19. William Brangham gets a frontline dispatch from a group assisting the hospitals there.
The International Medical Corps is working right now in New York City, the epicenter of America's outbreak. They're bringing in volunteers from across the country to help 4 different hospitals to help support the people who are working in those hospitals as they deal with COVID-19 patients. Susan Mangicaro is the New York coordinator for the International Medical Corps, and she joins me now from the Javits Center in New York. Susan, thank you very, very much for being here. Could you just start off by telling us, you're in New York City. Most of our viewers are elsewhere in the country watching what's going on in New York. Could you give us a sense broadly of what you've been seeing over the last weeks, the last month or so?
When we arrived on April 2nd, it was really at the peak of the storm here. I've served in disasters for International Medical Corps across the world, and I've never seen anything like this in the United States. It was truly unprecedented. Hospitals were completely overwhelmed. Staff was basically in shock and traumatized from having to make some choices that we're not accustomed to in the United States. And simply the number of deaths of patients dying alone. The supplies that were needed were eventually brought in, but initially things were very, very tight. Luckily, things are slightly improved this week, but still quite devastating. The system is in a state of shock.
As you alluded to, the International Medical Corps normally responds to wars, conflicts, disasters in other nations. Do you ever stop for a moment and just sit back and think, we're doing this here in the middle of New York City?
Yes, all the time. It's surreal. Seeing and witnessing in hospital emergency departments the stress that the system was under. It's something that, again, we're just not accustomed to this in the United States. You're used to seeing that perhaps in resource poor regions or regions that have been devastated from natural disasters or war conflict areas, but certainly not here in our own country.
Are there lessons that you've learned from doing humanitarian work of this sort in other nations that's applicable here?
Absolutely. We've done this both in disaster response, but infectious disease outbreak from Ebola to cholera. We know how to set up quickly. We know how to bring in the people that are accustomed to dealing with trauma very rapidly. And we have support from wonderful partners and organizations that allow us to do what we do and bring in the relief where it's needed most.
You're obviously there to help backstop the frontline healthcare workers that are working in these hospitals and provide relief and sort of rotate in when they need it. How are those people doing from your experience?
So I'll tell you from both perspectives. We've done a number of things here. We brought in emergency field shelters for them to use as surge capacity. We brought in supplies and PPE, but most important, we've brought in medical staff to help relieve those overburdened staff workers. Some facilities were down 25% of patients of staff because they were COVID positive and sick. And those that were there were working very long shifts and in very critical areas that the hospitals had to adapt to.
You're standing there in the Javits Center, which we know is an overflow, a big convention center now turned into an overflow hospital. We have been seeing some reports that New York State and New York City might be bending its curve a little bit and seeing some plateauing of cases. Has that been your experience thus far?
Yes, certainly in the emergency department, the number of admissions are down. That is help providing some relief and to decompress a little bit. However, if you look at the number of patients still in the intensive care unit and the acuity level of those patients, they're still at capacity, if not over, beginning to decompress some. So there is a little sense of relief here in the healthcare system. They're very trepidatious about backing off because the concern is what if it skyrockets again? We certainly do not want to see what happened the first time around happen again. And I don't think it will. I think one of the biggest lessons for all of us is that, preparedness is really important.
All right, Susan Mangicaro from the International Medical Corps. Thank you very, very much. And thank you for all the work you're doing.
Thank you so much.